Hello, my name is Ellen Brown, and I'm an acupuncturist and an herbalist. And this is the start of a series of videos dedicated to chronic fatigue syndrome and how Chinese medicine can help you get beyond exhaustion. CFS is a complex, debilitating disorder characterized by profound fatigue that does not improve with rest and is often something that gets worse with either physical or mental activity. Importantly, there's no known cause, no medical test to identify it, and no known medical treatment for chronic fatigue syndrome. So the first and most important challenge that you have if you think you have CFS is getting the correct diagnosis. Now, while we all experience days when we feel weary, tired, overextended, we may lack motivation or the energy to carry out our day-to-day lives, most of us bounce back after we've had a few days rest, a relaxing weekend, or a vacation. With chronic fatigue syndrome, however, it's a relentless tiredness and exhaustion that cuts people's energy often in as much as half and does not get better with relaxation or rest, even after several months or several years. Importantly, there's no underlying medical condition that helps explain chronic fatigue syndrome. And while chronic fatigue is not surprisingly a fairly descriptive analysis of what to expect when you have this disorder, it's not the only symptom that you'll have, and it certainly doesn't capture the full extent of what this disease is all about. In addition to profound fatigue, other serious symptoms of CSF include joint pain that often will move around from one part of the body to another, poor concentration, memory loss, muscle pain and weakness, headaches, night sweats, even fever and chills. And while many sufferers report that their CFS came on suddenly, with often the onset of flu-like symptoms, most experts believe that CFS involves a combination of several factors that will often vary from person to person. Some of these include latent viral infection, immune system dysfunction, hormonal imbalance, nutritional deficiency, even emotional trauma may all be part of the underlying story of what is causing chronic fatigue syndrome in people. Because there are no characteristic laboratory abnormalities to look for, no blood test, no urine test, no other brain scan that definitively point to CFS, it's a diagnosis that can only be made by exclusion. What that means is by ruling out every other kind of disease. Consequently, CFS is often misdiagnosed or overlooked since its symptoms are so similar to so many other disorders. And for instance, fatigue can be a defining symptom in as many as 200 different diseases. Moreover, because chronic fatigue symptom is so typically invisible, it's a disease that's misunderstood, and worse, it can even be dismissed by many doctors. A diagnosis of CSF is often still very controversial. Many doctors continue to perceive it as psychosomatic or imagined. And because it's a syndrome, rather than a single specific disease, patients are often dealing with multiple overlapping conditions at the same time, which could include fibromyalgia, depression, or even irritable bowel syndrome. For all of these reasons, it makes it very difficult to get a diagnosis of chronic fatigue syndrome. But don't give up. If you have any or all of the symptoms we've mentioned previously, consider consulting with certainly your regular GP or a doctor of Chinese medicine with our unique perspective of energy as well as a very holistic, natural mind, body, spirit emphasis within medicine. We can really work together to not only investigate your symptoms, but help to start you feeling better, having more energy and vitality, bring that back into your life. Again, my name is Ellen Brown. I specialize in the practice of Chinese medicine. You can reach me at my website, where we also have a lot of other very informative articles on natural medicine and Chinese